Hello and welcome to this channel, Clinic Wahala by yours truly, Dr. Catch. It's a channel we have created to reach out to everyday man on the streets, everyday woman on the streets, to bring forth teachings about health, all the medical things you hear, to bring them to you in a way you understand, so that you make good decisions pertaining to your health. So while you are here, don't forget to subscribe to this channel. Also share and tell your friends and family to join the channel and be part of what is happening here. All is engineered towards a healthy society. That's what we are doing here. So today, on popular demand, I've had cause to talk to people individually in the clinics about arthritis. Yes, I also posted a video some time ago about it, and people are seeking for more knowledge as regards this arthritis of a thing. And truly is worth talking about. Is really worth talking about. Is the commonest cause of disability in our populace. Arthritis is a general thing that refers to some of these problems that happen at the joints, whether it's your knee joint, hip, hands, fingers, back. All of them qualify as arthritis. When there is problem with those joints, we talk about arthritis. There are many types of arthritis, but that's not for the scope of this discussion. The one we are going to narrow down to is osteoarthritis. For this discussion, we'll be calling it arthritis because that's the commonest arthritis that we have. It's said to be a degenerative disease. What that means is that as long as we live and add years to our life, part of the things that the wear and tear we experience in life, one of them is this arthritis. So long as we walk, so long as we do activities and use these joints for our daily routines, there will be wear and tear in those joints. So over time, there will be some degenerations in these joints and arthritis will set in. So I can say it will almost always happen to people, but it comes at different rates. It comes at different intensities, and certain other things can make it happen to this person and not happen to the other person. So these are the things we are going to look at in this discussion and this teaching, so that we are all better informed. So I said it's the commonest kind of arthritis. That's one. Many of the arthritis are inflammatory. You have so many cells coming to act on the joints and all, but osteoarthritis is not like those ones. It's mainly a degenerative process, a process of wear and tear that happens with time. So I believe you already know that. When I talk about factors that can make this happen in people, yes, some people may talk about hereditary. Yes, there can be a hereditary component to arthritis, but that's not usually the case with the arthritis we have every day. If you take a look at your family, look at those that are older than you or our grandpas and grandmas, you will see the difficulty they have in walking. In fact, many of them may have hypertension, diabetes and all those things, but the one that concerns them most is my knee, I have a knee pain, I have a back, my hip, I can't bend, I can't stand, I can't walk, it makes noise when I walk, it's swollen, my knee is swollen. That's their main complaint. It's very hard to come to a clinic where you see adults and elderly people without having complaints of arthritis. It's very, very common and a big issue. Why is a big issue is that many of them have ended up harming themselves even more by going to pharmacies to pack pain medications. As I mentioned earlier, they take these medications that affect their BP. If they have heart failure, it worsens the heart failure. Those who are diabetic and hypertensive, whose kidneys are already in one corner shaking, you now go and hammer them with these NSAIDs, those drugs called NSAIDs. Example is your diclofenac, ibuprofen, naproxen. Some of these drugs are good for managing pain, but they are not always advisable for a long time for people like this, because they can be harmful to the cardiovascular system, the heart and its tools, and also to the kidneys. So it's important that we do not indulge in taking these medications from the pharmacy for long, because it can harm us. Your doctor can use it and maintain precautionary measures to be sure that it doesn't harm you. So, but it's not a drug you buy and you are firing it. Some of my patients will open their drug bag and you see 3-4 NSAIDs. They are taking all of them because this pain for them is from the pit of hell. It's so bad that you understand what I'm trying to say. So it's important that you know about arthritis and know that the way to go is not to go and pack these pain medications. Arthritis is a degenerative disease, meaning that I used an example before. If you have a mortar and a pestle you use in pounding tomatoes, onions and all those things, when you buy them they are fresh and neat, but by the time you use them for 6 months, 1 year, look at their surfaces, you will see that there is some wear and tear happening, there's some erosion. Some of them are beginning to wear, both the mortar and the pestle. So these things are what happens in these joints. There are cartilages, there are fluids, there are bones that are all well positioned to absorb shock over time. That's why you really don't feel it much growing up. But as you age, these things begin to wear and tear. Friction, constant friction of movement happens to them, and areas that are not supposed to touch begin to come in contact with each other and give you pain. So that's why the main symptom for arthritis is pain. So whenever you walk or do exercise, you feel so much pain, and if it happens over a long time, your range of movement is restricted. You can't stretch the knees or the joints as much as you do before. So these are some of the symptoms that come with arthritis. You wake up in the morning and your leg is so stiff, it takes you time before you stretch it out. It's all part of the arthritis. That can also depict arthritis. Some people have swollen joints too. So these are some of the symptoms of arthritis. And this arthritis, like I said, it can happen faster in some people. You see somebody who is 80 years, the arthritis may be minimal. You see another person 50 years, the arthritis is massive. So many things can affect the progression of this arthritis. One of them is something we've been talking about: obesity. I've mentioned obesity. Weight. If you have so much weight on, it means that your knees and your waist and your ankles will carry so much weight too. You get what I'm trying to say? So it means that they are carrying, somebody who is walking free and walking on the road and somebody who is carrying 50 kg rice on the head and walking, who is going to have more stress and more strain? Obviously it's the person that has more weight on. So that's an example, can make arthritis progress faster. Some people who have the one we call K-leg, the one we call bow leg, in medical terms say genu varum, genu valgus. So but that's what it means. It means that the joints also, the way the joints are aligned, if it's not aligned so well that all the whole weight of the body is not spread across the joint, is tilted to one side of the joint, of course it means that side will have more pressure, to have more wear and tear, and arthritis can set in from there. There are many other things that can predispose to this arthritis or speed it up, but I'm just mentioning this to know that there can be a difference in the progression of arthritis. Some people who engage in exercises too, high impact exercise, you will see some footballers and people who do sports to a great extent who still come down with arthritis. Some have injuries during their career that wasn't well taken care of, and it changes the alignment of the joint and arthritis happens. Yes, of course, tedious exercise and high impact exercise will cause more wear and tear over time. Arthritis can also set in. So these are the things that can predispose to arthritis or speed up arthritis. So these, I believe I've laid down the foundation for arthritis. We will now go into the things we can do for treatment. I will have to pause here and we'll continue in the next video. Thank you very much. Don't forget to like, share and subscribe.